say you have these longevity genes. How do you turn them on?
Genes are just your computer program, but you can actually change what actually shows up on the screen. We now know that there's certain lifestyle changes that we can do that have been shown to decrease the expression of the gene. You're exposed to numerous different PFAs and different toxins and smog, and now smog's been linked to Parkinson's and Alzheimer's. So you can't really escape it. You have at least a 4 times risk of Alzheimer's. You can be up to 8 to 12. We're going to be able to know, okay, I have this mutation. I can now go and have specific gene therapy to fix it. And if those aren't working, then you can't clean your system as well as me, and then you're going to see the signs when we do traditional lab work.
Hello, friends, and welcome to Optimal with Ben Bowers, where we interview experts in the field of health, longevity, and alternative wellness. Today's guest is Dr. Neil Paulvin. He's a renowned physician with multiple board certifications in family medicine, osteopathic manipulation, anti-aging, and regenerative medicine. His Manhattan practice blends traditional and alternative medicine. An expert in peptide therapy, sports medicine, mitochondrial health, bioidentical hormone therapy, and longevity medicine, his work has been featured in the Wall Street Journal, CNBC, Forbes, Bustle, and other national media outlets. So without further ado, Dr. Neil Paulvin. Dr. Longevity.
I try to
Thanks
keep...
for coming.
Thanks for having me. I appreciate it.
What are the latest breakthroughs in longevity research this year?
I mean, some new improvements in terms of how we're using rapamycin has been very impressive in the sense that we're getting towards where we can get, we know how to treat specific goals with specific dosing and duration in between. Therapies that have now been approved by the FDA, which is a huge landmark, the fact that may allow us to do many more in terms of gene therapy that we're now able to do worldwide that we really can't do in the US because of some legal roadblocks there. Those are two of the big ones that we're seeing. And then actually something that came out last week in terms of longevity that we now have more data for something that we kind of already do anecdotally in terms of that we know patients who have a testosterone lower than 213 and also don't have enough estrogen will have a shorter lifespan. So there's always been this anti-camp of you don't need testosterone, you don't need to be on replacement. And now we have, not only do we know it's helpful and it will prolong life, but it's also, we now kind of have some numbers to shoot for in terms of where that floor is for both testosterone, estrogen, dihydrotestosterone, all those different markers. So those are a couple of the things that are out there. I mean, there's going to be so many more coming out, hopefully in the next 6 or 12 months.
Okay. And rapamycin, I take 6 milligrams every Saturday, 24 hours after a hard lift and 24 hours before. Is that a good protocol?
It depends on the goals and the age. I have patients between 6 and 9, usually 6 to 9 milligrams per week. In some patients, I'm actually checking their troughs and their high levels to see exactly, making sure how long they're maintaining those levels for. And we're seeing certain patients, the more healthy they are, the shorter that duration is. So we need to kind of figure out it's not something that used to be kind of cookie cutter for everybody, 6, 9, maybe in 12 milligrams. We're now seeing that it should be much more individualized, but for the general layperson, that's a very good beginning protocol in terms of starting the rapamycin.
And while we're on longevity compounds, what's the latest research on metformin and acarbose, the older brother?
So metformin is kind of unfortunately stuck in the mud and really losing ground at this point. The study that they're trying to do, the TAME trial, has just not been funded. And we know that again, there's negatives that it will help with in terms of that will cause some problem with muscle growth. So some people are now avoiding, especially the younger group of that. We know it's anti-inflammatory. We know it's an antioxidant. So there are things that are beneficial about it. It just used to be the only thing around when all the data, they started trying to fund that trial, I think 9 years ago. And now it's still unfunded. Now you have, again, rapamycin, acarbose, folacin, all these other things are kind of just going ahead of it at this point. Even things like taurine, astaxanthin, simple herbs and amino acids. So it's really kind of, I mean, I don't tend to recommend it as much in terms of an anti-aging supplement anymore. Unless people want something that's really inexpensive and that's the only reason I tend to use it anymore. In terms of acarbose, another study just came out I think last week or 2 weeks ago, that a combination of acarbose with rapa and something called phenylbutyrate may actually prolong life. This wasn't a human trial.
Phenylbutyrate?
Phenylbutyrate, yeah, sorry.
Phenylbutyrate. Okay.
So
I take acarbose and rapamycin.
Yeah, so that has the most data in men. Women still is being shown that it may actually shorten life. So women, it's not as recommended unless there's a sugar or insulin resistance issue. But men, acarbose has this much better data. It's been tested longevity trials through the NIH. That's the one that we tend to lean much more on now.
It helps improve fat metabolism, right?
It's going to potentially affect the microbiome of the gut. They think it also may help brain health to some degree.
You just mentioned brain health. Why should everyone know their ApoE SNP?
They should know their ApoE SNP because if you're ApoE4, you have at least a 4 times risk of Alzheimer's. You can be up to 8 to 12. For people who don't know out there, you're going to get usually a gene from mom and a gene from dad. And hopefully if you get one abnormal gene, it's about 4 times the risk. And if you get one bad from mom and dad, then you're getting the 8 to 12 range. And that whoever watched the Chris Hemsworth Anti-Aging with Peter Attia like 6 months ago, he's now doing all these specific lifestyle changes.
He has both of them?
The information they used then was 8 to 10 times greater likelihood of having Alzheimer's than the average person.
Check your ApoE gene.
I tell everybody now with that and things like full body MRIs, you have to be okay with getting the information. Some people just still want to live in a kind of a bubble. They don't want to know. They just want to live their life. That's fine. Just understand the plus and the minuses to it, because some people who just don't want to have that black cloud living over their head. And I get that too. But yeah, I think in any case, more data is better.
What other genes should we be looking at to promote longevity and healthy lifespan? FOXO4?
Klotho. We're looking at FOXO4. We're looking at
Klotho.
Yeah, we're looking at FOXO. We're looking at Follister. We're looking at all these things. A lot of them, we're this close now to really knowing exactly how to manipulate them all. And now we're actually working kind of backwards in the sense that there's now some new labs that have come on the scene in the last 12 to 18 months where they're going to draw your blood, do all this testing for you, what are called proteomics, and do all the genetic testing. They're going to do a full, and then they're going to say, okay, you have these things, and now we can create a specific peptide or IV for you to deal with those things. That's where we're heading probably in the next 3 to 4 years. Mm-hmm. I mean, it's coming soon. The price point's pretty high for most people, but that's where we're going. I mean, the simple things now we know are, again, FOXO4, MTHFR is a simple one that people know, ApoE4.
MTH what?
MTHFR, which is a basic one, but it affects inflammation. We know that it affects brain health because it affects the homocysteine metabolism, and that's an increased risk factor for Alzheimer's if it's above 8. So that's something that we definitely look at.
So you have these longevity genes. How do you turn them on? Or do we all have them and we can't turn them on and off?
Gene expression now we know is about 20 to 30% of what happens that we actually see and feel and experience. So if we now know that there's certain lifestyle changes that we can do that have been shown to decrease the expression of the gene. Genes are just your computer program, but you can actually change what actually shows up on the screen. We know caloric restriction, meaning that you're eating less and you're burning. We know that try to go to zero alcohol, no smoking. Those are things that have been proven time and time again to help regulate the expression. We think things like alpha-ketoglutarate and low-dose lithium may also be there. Rapamycin's being tested now.
So hold on, alpha-ketoglutarate. Mm-hmm. And what was the other one?
Low-dose lithium.
Low-dose lithium. Okay.
That has some potential as well. Again, now they're looking at things like rapamycin as well as acarbose, which you mentioned before. So that's the
what other natural supplement compounds
that will help slow down the genes? It depends. We know there's a supplement called ergothioneine, which is an antioxidant mitochondrial, which may help. It really depends on which one we're targeting. Again, MTHFR, it's simple as just taking a methylfolate and a methyl B12 and some TMG, hopefully. Some people think spermidine, which is from mushrooms and wheat germ, can be helpful. We need the ones I mentioned, the ones that have the most hard data. Literally every week or 2 weeks is a new one that's coming out. So it's usually a combination of the supplements with the lifestyle changes. The next step is going to be the actual gene therapy, which I kind of highlighted initially. Mm-hmm.
Which is follow-statin gene therapy.
We're going to be able to know, okay, I have this mutation. I can now go and have specific gene therapy to fix it. We're not there yet. It's coming again, probably in the next 2 to 4 years, where we can actually just go in there and kind of, you have a bad, like you go to the auto mechanic. I have a bad spark plug. You take that spark plug out, you put the new spark plug in, and hopefully things are going to be improved. Between that and things like CRISPR, all that's going to kind of take the people who really are doing that deep dive into the next level.
Urolithin A. Are you excited about this compound from pomegranates?
I am very excited. To me, it is probably one of the 2 supplements now that has the most exciting data out there in terms of supplements, in terms of both aging and just general health. It initially came out more just to help recovery. The Philadelphia 76ers were using it just to boost recovery and potentially build muscle, and that's where it started. It's a substance that will help induce mitophagy, which is the recycling of your mitochondria, which is the energy part of your cell. And now it's being found that it helps to heal your gut. We now know that it can help heal neurons, cells in your brain. It's going to help regulate your immune system, similar to, not to the same strength, but actually similar to what rapamycin's doing in terms of modulating your immune system. But people need to understand is I'd love everybody to get it from food. Only about 30% of people can have the microbiome genetically suitable to actually convert it to something that's usable.
Only what percent?
30 to 40% of people can actually convert it to usable. That's why we pretty much recommend almost everybody take the supplement just for to make sure that you're getting enough of it to achieve all the different reactions that it helps.
What's the best supplement?
Right now, there's only
Mitopure.
There's only Mitopure. Yeah, Mitopure. They have the patent on it, and that's the only one in the game right now.
Any other exciting compounds?
Another one that has all the exciting information is something called Fatty 15.
Fatty 15, I've never heard of it.
Yeah, Fatty 15 is most people have heard of fish oil, omega-3 fish oil. This is now becoming omega-3 fish oil on steroids in a good way.
Okay, I take 4,000 milligrams. I think 2,000 EPA, 2,000 DHA per day.
Yes,
from small fatty fish. I think it's krill.
Yeah, that's what we had recommended for longevity. Now, a lot of us in the longevity space are converting all our patients over from that to Fatty 15. It actually induces mTOR, which is why people take rapamycin. So it may help with autophagy. Again, in terms of, it has really great potential in terms of brain health. Mm-hmm. It just appears, and one study showed that it's actually better as an anti-aging molecule than both rapamycin and acarbose. I mean, it was one study, not well double-blinded, but it shows the potential of the product at this point.
Fatty 15.
Fatty 15.
Okay. Is it a capsule or is it an oil that you put inside of your
baby capsule?
Baby capsule. And how is it different? Is it engineered in a lab, or?
It was found in dolphins. So it's just people know it's instead of like 3 or 4 carbons, it's actually 15 carbon, which the name comes from. So the fatty acids.
So dolphin fat is the best.
And they don't need flipper, but yeah.
Environmental toxins. EPAs, BPAs, the distant cousins, EPAF or EPF.
Mm-hmm. Yep.
Molds. How can we test for these inside of us?
There's a lot of different ways, and I tell my patients to do all of them combined, because if you live in Manhattan, any major city right now at this point, you're exposed to numerous different PFAs and different toxins and smog, and now smog's been linked to Parkinson's and Alzheimer's. So you can't really escape it. So the question is, first thing we want to do is measure it. And then the next thing is we want to do is see how your body's getting affected by it, because my detox system may be great and my genetics may be great and my liver and my kidneys and I go to the sauna and I sweat. I may not be as affected by it as somebody who has glutathione or superoxide dismutase, which is kind of one of the master detox genes in your body. Those genes.
What is it called?
SOD, superoxide dismutase.
Okay.
And if those aren't working, then you can't clean your system as well as me. And then you're going to see the signs when we do traditional lab work, in terms of looking at this inflammation markers. And we can do a deep dive into all our different genetics and how our metabolites are. So it's a question of what are you exposed to? And then how is your body being affected? So we look at it in a lot of different ways. The main thing now is a lot of urine toxin tests that you can get. There's a couple of really good ones that can be done where we're able to look at pretty much all the different things that you mentioned, from the BPA levels to mold to, again, all the PFAs, the lead, mercury, arsenic, cadmium, all the things that you're exposed
Herbicides,
to.
pesticides.
Exactly. So all that in one. And
in a urine sample.
It's in a urine sample, yes. And it's the best one-shot way. In a perfect world, there's certain ones that would be done better by doing a blood sample, and most of them you can do in a urine sample. A lot of times we just do this for ease initially, and then if we need to really break it down, then we can do specific blood tests, because the blood tests are just more exorbitantly expensive at this point. So we're figuring out what they have, looking at their detox markers, looking at their inflammation markers, or their oxidative stress levels are really high. And then specifically you mentioned mold, which is not something that everybody is exposed to. And people need to know that about 25% of people have genetic mutations where they can't deal with mold. And those are the people who unfortunately have brain fog and gain weight and have to actually leave where they are. And then there's certain blood tests that we look at, things like transforming growth factor beta 1, and we're looking at alpha MSH and all these other different enzymes to see how bad their body's affected, because not everybody's affected the same way. Obviously, if somebody comes to you and says, I'm dizzy, or I can't even think, and I used to be a top executive or whatever, then we know we need to be much more aggressive in treatment. But where we are now compared to a couple of years ago, now, especially with this whole microplastic kind of awareness that everybody has now, has kind of taken things to the next level.
Mm-hmm. So say you do a urine sample and you do find some either heavy metals or herbicides, glyphosate, pesticides, EPAs. What's the protocol for detox that you would put a patient on?
Everybody's different. I mean, the main things we're going to usually use, we're going to use some type of binder. Usually we're going to start most patients, unless they have high levels of mold or high levels with high symptoms, on an oral type of binder. And they have there's different ones. There's something called cholestyramine, which is a cholesterol medicine that's been shown to be a really good binder. Other things, we're using things like zeolite and charcoal and diatomaceous earth and things like that are we can kind of mix and match depending on what we see on their test. And then we're combining it with detox supplements, things like glutathione, NAC, ergothioneine, ALA, alpha lipoic acid, which are great antioxidants, and TUDCA, which is a great liver detox, or dandelions. And then we also we try to make the kidney function appropriate, and then combine that with sauna to help their body, again, get as much of this stuff out as we can. The key is not just getting it, finding it and binding it. We want to make sure they're able to clear it. And then we can kind of, go 100 more different ways, depending on a lot of different things.
You mentioned glutathione. Mm-hmm. So I had my genome sequenced, and I'm missing a stem from my mother and my father, so I have to take it 5 days a week. It's liposomal. Mm-hmm. Is that the best way you recommend?
It's the easiest. It's not the best. We know that
Sub-Q?
The best is injection or IV. We know it's about 5 times better absorbed as an injection or an IV than even the best liposomal. And I'll take it liposomal occasionally just because it's not something that's feasible every day to do. But the data is just.
Let's say you get an IV. How long will that last? A month?
We don't know for sure. The presumption is probably 1 to 2 weeks. The way I explain a lot of this stuff is going to be, depends how empty your gas tank is. If you have an eighth of a tank left, it's going to work like that and last for a while. But if your tank is already 95% full, you may notice it for a couple of days, and then you're back to where you were. Yeah. So it really depends on how bad you are. But for you, you'd probably notice it for a while.
And NAC, N-acetylcysteine precursor to glutathione, is great before bed.
I love it. I think it has more potential than glutathione because it's also because we now know it's that combined with glycine helps patients with brain health. Okay. It's also an anti-inflammatory. Anybody, unfortunately, who's had any type of COVID effects as a COVID treatment, I like it better. There's more data to me than glutathione for that. So I'm an NAC fan all day. Again, there are certain genetic mutations that you're not able to use it as well. So patients have had that, they know. A lot of patients will know, I can't use NAC, I use glutathione better, or vice versa.
How can you tell?
It depends on the genetic mutations that you have.
So if I sent you my genome sequencing panel, my comprehensive genome sequence, you'll be able to tell me if I can convert NAC to glutathione easier or taking the liposomal is better.
Exactly. Yes.
Okay. Great. I'll send that right over.
Yeah, let me know.
Thank you.
Glad to do it.
NAD. You love NAD patches versus sub-Q NAD versus the precursors, NR and NMN?
This is like the $1 million question right now. I was at a conference 2 weeks ago when we were debating this topic, and there's no right answer. We know that there's only 2 products that have any data behind it right now that's actually been proven, and that one is NR, which is like the products like True Niagen, products like that. Mm-hmm. And there's a new product out called Endotelio, which works on NMNT inhibitor, which works a little bit differently and has better data in terms of boosting NAD, helping skin care, potentially helping healing blood vessels and things like that.
What was it called again? Sorry.
Endotelio.
Endotelio.
Yes. I can't think of the name that coming off the top of my head, but those are the 2 that have data behind it. We know NADIVs have no data, except there's a couple, 1 or 2 small studies in terms of mood issues, like people who have bipolar or depression. Patients, a lot of patients will feel better with them, but there's no true data showing that they're
because it can't get into the cytoplasm of the cell, right?
That's part of the philosophy there. It just enables us to get much higher doses without the flushing. And anybody's even taking oral NAD, some people get flushing, some people get nauseous, some people get brain foggy with it. So it enables us to get much higher doses in them. And I've used this successfully with patients who have poor energy. Unfortunately, patients who have COVID or long COVID, it works really well. We don't know exactly why. The word that's going to start exploding now is a bunch of studies that have come out in terms of fertility and how we need NAD for both on the male and the female side to help maintain and boost fertility in patients who can't get pregnant. So that we're trying to figure out the best formulation.
There's a huge decrease in male fertility right now.
Mm-hmm. By at least 50%, yes.
That's terrifying. I want to get mine checked.
That's become, we're really doing a deep dive.
What do you think it's from?
I mean, a lot of it is stress and oxidative stress. A lot of it is the toxins, especially what are called endocrine disruptors that you mentioned BPA before. We know that it will make sure that your body either is not able to make testosterone for you to help in the fertility process.
Is it laptops and cell phones in our pockets?
It's mitochondrial damage. It's mitochondrial damage. It's the toxins. It's inflammation. It's oxidative stress.
Do you believe in EMF's electromagnetic field destroying our earphones, our cell phones in our pockets, our laptops in our laps, our Wi-Fi? Do you think? What is the research on that? What is saying?
It's all over the place. There is more and more data coming out that does cause inflammation, decreased brain health as we get older. The cancer big question mark still has not been answered yet. Also, it's like I mentioned with mold, we know that some patients, because of their mitochondrial health or their DNA, can't handle that stress more than somebody who can. So, but there's definitely a component to it. It doesn't mean everybody needs to build a box to protect their EMF. I mean, there's people who are very EMF sensitive where they can't have anything even in their bedroom to sleep. I mean, we still recommend no computer, no laptop, no phone in the bedroom if possible, because we know it does affect your quality of sleep, and it may affect brain health. And that's why we're seeing it was kind of a big controversy that a lot of these, everybody wanted to have a sleep bed or a sleep monitor, that a lot of them had EMF, or you had to have your phone as the kind of the pivot point to it. And now we're finally seeing some of these companies get away from that. Sleep, who's one of the biggest now in terms of sleep monitoring in the country, they finally went away. There's now part of their device where you don't need your phone. So they know a lot of people are concerned about the EMF. It's something you definitely need to be aware of. You can get an EMF monitor really cheaply on Amazon.
Yeah, I have one.
Whatever is going to, again, not luckily, but depending, everybody's different. Yeah. So I'm not sensitive. I know I have friends who can't even go in the same room where there's like a phone and a laptop. They just feel like their body's getting shocked or their brain kind of misfires, and they go to Montana, or I have a friend who's in like the Dominican Republic now just to get away from it. They can't live in a major city anymore.
Whoa.
So everybody gets affected by these things differently. It's just but the main thing would be if somebody tells you that you're crazy, you're making it up. That's not true. That's unfortunately has become part of this medical science, which we know now that it can affect people pretty dramatically.
Prenovo.
Yeah.
Do you love that test?
Same caveat I gave before. As long as you're okay with the information, I think it is the best test. One of the best tests are out there. in terms of giving us so much data initially. The big question mark of it is some people are leaving to all these false positives, which we would get anyway if we did the test. And we now know what's something that needs to be followed up on, and something that you just have and we just don't worry about it. But for people who don't know, Pronovo is a full body MRI. There's no radiation involved. It allows us to look at the whole body in terms of are there, unfortunately, any type of cancers or masses. We're able to now look at your full spine, and there's patients who I've been having this back pain and there's nothing there, or we know that they have severe arthritis. They're able to look at some of the blood vessels to see if there's an aneurysm, which is dilation of the blood vessel, which can be fatal. We're now able to, we can look at all the organs for cysts. They have what's called fatty liver, which we now know has a lot of longevity components to it. So we can look at all these things in one study that takes 90 minutes. The downside right now is the cost, which is prohibitive for some people. It is AI, which we now know that AI for radiologies can improve the results up to 30, 40%. We're using it for dermatology now. Like that, we can look for skin cancers much quicker than we could before. AI is going to boost and revolutionize the radiology space, but Pronovo is something that for patients who can afford it, I recommend them doing.
And while we're on AI for measuring these things now, tell us about the Clearly scan for your heart.
Clearly, another test that's on my top list for all my clients. That Clearly would probably even be higher than Pronovo at this point, because it's everybody we're going to get data for. When you get it Clearly done, it is able to look at hard and soft plaque. Hard plaque has been calcified, so you can almost see it kind of like on an X-ray. Soft plaque actually may be more is almost definitely bigger risk in terms of leading to heart attack or stroke than hard plaque, because it's hard, so it's not going to break off. Soft plaque obviously is not as solidified and can lead to more risk. So we're getting a picture of how bad it is, if any, where it is. We have 4 major arteries that we're looking at, actually 5, and we can see where that blockage is and how severe it is in every area. And there now, with their AI technology, we're able to get what's called an ischemia score, which means the lack of blood flow to a specific area, and lets us grade does this person need to be on prescription medication? Does this person need to be on high dose medicine? Does this patient potentially need to go to the hospital and get an emergency procedure? So there's a lot of great data, and you can do all these things. If your heart and your brain aren't working, the rest is kind of a moot point.
Right. So I have cardiovascular disease in my family, and I have some cardiovascular gene SNPs. So you got me a script for Clearly, so I'm excited to see those results. Also, I'm pretty fat adapted all day, and then I have carbs in the evening or blueberries in my smoothie every day. But I take in a lot of saturated, monounsaturated fats. So my cholesterol's up, and also ApoB is high. So I'm interested to see what that looks like from the Clearly scan.
And that's what's great about what the Clearly can do, because I have patients who have high cholesterol levels, either because of the genetic, they're on a keto diet, or they have a poor diet. And if unfortunately that's already led to a lot of blockages, we know we need to be more aggressive. Or if they have bad numbers and there's nothing, they have a 0 score, which is great, then we can adapt the lifestyle and maybe not be as aggressive. So it allows us to adapt a specific program to you versus somebody else who has, I had a patient who had a 99 score, which is the worst. And I had a patient who had almost the same level and had a 1 score. So again, they're not going to need to be on the same type of protocol. They're almost the same age. But and also we know which cholesterol markers we need to look at this point now.
Okay.
And which are kind of not as important. Okay. Because there's so many.
What's the truth about GMOs, genetically modified organisms?
Another debate. We don't know anything specifically. Not that we don't know anything specific. We don't know the debate of right now. We know that the body does not handle them as well, potentially. The body doesn't handle them as well, potentially. There is increased risk for inflammation. There's increased risk for having damage to your genes. Not damage to your genes, but the genes won't work as well, and you may have your genes may actually manifest certain issues more with the GMOs. Again, depends on how much you're taking in, what we're taking in, what the GMO is. I just advise my patients not to really use them as much as possible, unless we have to. And then in terms of the pesticides and that type of conversation, that goes back to what we talked about before. We can detect a lot of that on the data side. and then see if they're being affected or not. So it pervades our health at this point. It's just a question of trying to avoid as much as possible, as well as just, again, the way I'm going to respond to it is not the way you're going to respond to it. And now we have so much more access to data than we even had 6 months ago or a year ago.
Okay. And gluten?
Gluten, if you test negative for being gluten allergic, and we can test that very easily at this point through either a blood test or stool test or both. I usually recommend both. Then it comes down usually to a sourcing or carb. I mean, if it's coming through a healthy carb, then there's not much. You just want to eat like you would otherwise. Mm-hmm. I think the other part where it becomes very relevant, if somebody has an autoimmune issue, is something I would try to limit, and especially see how your body feels on gluten. A lot of my patients who have anything from lupus to multiple sclerosis, if they do take in gluten, their symptoms tend to exacerbate, and then we just take it away. What there now is our supplements, kind of like lactate for patients who are sensitive to dairy, where we can give you a supplement that helps your body break down the gluten, mm-hmm. and then so they can get some of the calories and the good things from the carbohydrate without having the side effects. Because it's harder. I mean, patients who are low carb, again, things that we see in patients who are keto is kind of a balancing thing in terms of where you want to go with it.
Lactate enzyme breaks down gluten? I thought it broke down dairy.
All right. You can get lactate, which has a lactase gene in it to help your body break it down. So now there's a supplement you can take if you are gluten allergic or gluten sensitive, to take it before you're going to have a pizza or something or a bagel, and then your body will not have the same side effects you would if you did not take the supplement before.
Okay. Methylene blue. My friend, he takes methylene blue rectally because it goes straight to your bloodstream. Mm-hmm. What are your thoughts on methylene blue?
Another one that I love, I think the dosing is a little too high for a lot of people. You don't need that much, and you actually may make things worse. I think methylene blue by itself has a huge potential in terms of it's an antioxidant, it's antibacterial, it's antiviral, it may regulate your immune system, has very minimal side effects unless you're on some type of antidepressant or psychiatric medication. But in most cases, either orally, rectally, IV-wise, less is sometimes more. You don't need to be, I see people come in triple digit doses, unless you're doing it to cause oxidation, which the only time we're really doing that usually is patients, unfortunately, or have cancer, and there are doctors who are using methylene blue for cancer at this point, as there is some data showing that it may help. Otherwise, I think most people should be on it. I just think it's usually at a lower dose than a lot of people are doing it as. I mean, there's different formulations, like I said, there's oral, there's nose spray, there's rectally. I mean, the nose spray is great if the main thing you're looking for is cognition or if you have brain fog, but it's not going to give you the antibacterial, antiviral as much. The rectally, some people love rectal, some people don't. There's just the initial part of it. It does absorb quicker, and some people get brain foggy with it or feel really jumpy with it because of the ATP boosting component of it.
So you just put it up your bum.
Put it up the bum. I don't, but yeah, I mean, I take mine either orally or IV.
Okay.
But there are people who rectally a lot of times. We're doing a lot of things. I mean, the people are doing melatonin rectally. People are doing methylene blue. We're now doing butyrate rectally. So that's a way to do things. Most people aren't going to. There aren't a lot of people who want to do that on a daily basis. Yeah. But there are some.
It just dissolves in your bum?
Yep.
Okay.
It just breaks down.
That's interesting.
And it goes right in there because there's vessels there.
And okay. Very interesting. I did not know that. Okay.
There's an image for people out there. Yeah.
What is low dose naltrexone?
Low dose naltrexone is a lower dose component of a medicine that's been out usually used for opioid toxicity called naltrexone. It also is used for alcohol abuse, where you kind of snap somebody out of it right away. That's usually around 50.
Like Ibogaine.
Yeah, it's kind of, yeah. And that's usually around 50 milligrams. So we're now using it at about 1/15 of that dose. And we're using it both now. Initially it was used as a medication for medical issues, for pain, neuropathy, brain fog. Now it's also become a longevity supplement in a way, in a sense, because we know it helps. We know as people get older, we know as your lab level, your testosterone gets lower, and we know that your hormones get lower. You also have your immune system will start to degrade as you get older, called immunosenescence. People have probably heard of senescent cells, zombie cells, and so on. So now we're using it because it helps to regulate or modulate our immune system. It kind of gives like a reboot, like kind of old school resetting your computer. So we're not using it for that component. We're using it because it does decrease your inflammatory cytokines, or the chemicals that cause inflammation in the body, which we now know is linked to heart disease. We now know it's linked to Alzheimer's because we measure those levels. So it's being used in that respect.
It's interesting. I didn't know that.
It's great exciting because it has minimal side effects. The main side effects are it can cause insomnia the first couple of days. And also it can give people dreams like psychedelic dreams the first day or two. You do a bigger deal now. Now some people actually want the psychedelic. So that's a whole other conversation, but it's inexpensive, very minimal side effects. Almost everybody will notice something from it, which is great. It's not covered by insurance, not a prescription, but it does have a lot of good utility with it. Using it now, a lot of either my nootropic patients, people who are like executives who want to go have their brain like 11 out of 10, or unfortunately, people who have Alzheimer's or Parkinson's, where the cells in the brain have been damaged, and it helps to heal them. So it's a winner on both ends.
What about those with TBI issues?
It's the same idea. Because of either the glutamate release, or it will help heal what are called your microglia, which are part of your scavenger cells in your brain. There's two forms. There's a good form and there's an evil form. And when that evil form gets triggered by the TBI, it can hopefully calm down the inflammation, then reset that cell from going from evil to good. So
you mentioned the cytokines. Does it increase your immuno T cells?
It will, in theory, it will balance your Th1, your Th2, first of all, which is your allergy and immune reaction, which you need to fight off viruses and also deal with common allergens like pollen. It also will be, again, some people have too much of the bad immune system because their bodies has been hyper tuned to certain things. And it can hopefully kind of, again, hit that reset button and get people back to normal. Also, like I said, some people have a very low immune capability as they get older. We can measure that through traditional labs, through biological aging tests. So if somebody has their immune system at a quarter of a tank, by doing things like urolithin, low-dose naltrexone, and rapamycin, we can hopefully get that tank back to, you can be 50 and hopefully have the immune system of a 25-year-old. That's kind of where we're going for, a combination with some other things that are out there.
What are your favorite exercises for improving longevity? There's the vigorous exercise, there's increasing your VO2 max.
There's a little bit of everything, like you said. So, it's still the simple things. There's data that we know squats, lunges are still some of the best things that you could be doing. We know doing wall sits are actually very, very helpful in terms of aging. We also know anything that's going to boost your grip strength. That could be dead arm hangs, that could be bicep curls, anything that's going to work on boosting your grip strength is going to help boost longevity. And then you mentioned the VO2 max testing, VO2 max exercise protocol. And what we're looking at there is pretty much what's kind of uniformly used now is the 4x4. Go as hard as you can for 4 minutes on a bike or a treadmill, rest for 4, and do that 4 times.
The Norwegian 4x4?
Yeah, that's the easiest way to do it. We know that having a high VO2 max is linked to longevity. And then I tell my patients every 10 days or so, you should be doing zone 2, which is you should exercise, be able to have a conversation, but be a little short of breath. And that's the other component. So you got zone 2, you got high peak VO2 max, and doing the specific working out in the gym. And then it's the frequency of getting in there at least 90, optimally 120 minutes a week as well. It's a little bit of everything.
Mitochondria. What are your favorite mitochondrial peptides?
We could be here all day.
MOD-SC?
The best one in a vacuum now is probably SS31, called alambretide, which is the most powerful. It's one of the most powerful antioxidants. It helps with the brain health. It helps to recycle the mitochondrial better. And then we have MOTS-c, which is great, is still very good. It just SS31 is like the Ferrari, and MOTS-c is still like a nice little Mercedes. So they're both very good. MOTS-c is great for boosting AMPK, which helps energy levels, helps you lose weight. It helps to build bone for my patients who have osteopenia, which is decreasing their bone density. The third one is Humanin, which is now coming back on the scene. It's another mitochondrial specific peptide like MOTS. That also may help in terms of, the thing it may have linked to fertility, as well as healing your mitochondria. Usually I have patients do one or the other. They don't need to do all three. But those are all three of those specific mitochondrial peptides are great.
So they're increasing mitochondrial biogenesis?
They are recycling to a certain extent. They are making the mitochondria work better. They are not specifically doing mitochondrial biogenesis. I mean, that you can do, exercise is doing that, cold is doing that, PQQ, which is a supplement, can do it. MitoQ can help with that. Resveratrol can do that. So it's usually a combination. Most people, if they're exercising and they're taking a CoQ10 and one of the peptides, they usually have that part pretty much covered.
Okay. So then what are these other ones doing, these peptides? They're improving the mitochondrial.
They're improving how well it's functioning. Because even if you recycle it or have more of them, if it's like, if you have a bunch of 1 out of 10 whatevers, doesn't really help you much. So you not only want to have a lot of them, you have them working at their optimal level. You want to get rid of oxidative stress. So that's where the SS31 comes in, producing the AMPK. It's going to give you more energy. It also helps the mitochondria work more efficiently, produce ATP more efficiently, make sure each component of the mitochondria is working well.
Interesting.
So yeah, in terms of mitochondrial health, you want to have the mitochondria working well. That's why people take things like NAD or methylene blue. You want to make sure you have enough, which I mentioned how you do there, and then kind of oil it up. And then red light therapy and hyperbaric are great too.
What's your favorite company who makes infrared?
In terms of full body, I mean, I recommend 3 or 4. I mean, it depends on kind of what you're looking for. Gembared makes really good products. Gembared and what's the name of the company now?
Juve?
No, Juve is unfortunately not good at all. Not good quality at all. They have EMF. Really, if you don't want any EMF exposure and any leakage, and they have both. Okay. There is, I see the guy's name. I can't think of it.
What about Soluma?
Soluma's decent, but it has to be close. You want it within 6 inches of your face, if not closer, and it's not always that way. Usually for the people who do their face, I usually recommend the mask at this point. I'll think of the other company in a second. I mean, I use the FlexBeam, Gembared, MitoRed is good. And there's another product, and I see a BioLight Shop is the other one.
BioLight Shop.
Yeah. So then they have a blanket, a red light blanket, which people like because you now can get everything in one time. And then also a company called EMR Tech has actually like the red light bulbs, which I use at night to help with my circadian rhythm. So it depends on what you're looking for.
There's a infrared laser. You seen those?
Mm-hmm. Those are different.
What are your thoughts?
If it's quality laser, it works really well for inflammation. It may help regulating the immune system. It's just a lot of the people out there are getting a very low quality laser and doesn't do much. It actually may cause more inflammation. I was actually just talking to a friend of mine who's getting a good quality laser can be $20,000 to $30,000. The good stuff is not cheap. So if somebody tells you get something for $100, $200, it's probably better just to move on. And just get something else because it's not really going to achieve you much benefit.
What is osteopathic manipulation and craniosacral therapy?
Sure. So osteopathic manipulation is a technique that's done by osteopaths, which are similar doctors to MDs. Has 2 different components to it. A lot of the techniques are similar to what a chiropractor would do, where you're able to adjust or crack somebody from head to toe. But it's also more of a holistic approach. We now know you may have shoulder pain, but it's not because your shoulder's inflamed. It's because your whole posture is off. You may have a quadratus lumborum, which is the muscle in your back, is tight, and that's affecting like your rotator cuff or those smaller muscles in your scapula. So it's a more holistic, more full body approach, then sometimes like chiropractor, oh, your neck hurts, it must be your neck, I'm just going to adjust your neck and you're fine. It's not always the case. Craniosacral therapy is something that was developed in the early 1900s, where they're evaluating the flow of blood, the fluid, the cerebrospinal fluid from the brain down to the tailbone, which is where craniosacral comes in. It was used a lot. I used to do a lot more of it. Other people used to do a lot more of it before we had some of these new advanced pain treatments, like things like hyperbaric red light, things like that. It still works really well for patients who have chronic headaches. What it's able to do is adjust the flow of the lymph fluid and the cerebrospinal fluid. It's also able to, sometimes if somebody has fallen or hit like their one of their sinus bones here, you can adjust that and get it to kind of go back in. It sounds kind of weird to some people, but it does work. It's become almost a lost art in a lot of places. Major cities will have them. It's not as easy to find anymore, but it can help for anxiety. The one thing that really I've used it for now is you have what's called where your occiput, which is the back of your skull, meets the top of your spine, is actually where you're part of where we can be exposed to your vagus nerve. Everybody now is doing things to work on their vagus nerve for health. They're doing breath work or cold plunge. So by just doing some gentle pressure there, we can actually get somebody's vagus nerve to reset, and also, which means that their HRV, the heart rate variability, actually may improve. Their stress goes down, and we can do it in about 2 to 3 minutes.
Okay. Wow. Let's come check that out.
Yeah. Do it all the time. Sometimes just doing things with your hands.
What's your favorite vagus nerve stimulation device?
In terms of what's out there now, there's 2, Hoolist, and there's a product called Pulsetto.
I just purchased that one.
Yeah, and it seems to be 50-50.
And the other one's what called what?
Hoolist, like coolest with an H.
Hoolist. Okay.
Yeah, I mean, I know I have one, and a colleague of mine has one, and we've tried a lot of the other ones, and this is the only thing that moved the needle. But the other people like Pulsetto. I think those are the 2 that seem to have ahead of the pack right now. I think there'll be a lot more coming out. I know some of the red light companies are now going to have an add-on where you can have something that goes right over the vagus nerve, and that will kind of be the next level. But right now, those are probably the 2 that I've seen the best of benefit with in terms of the stimulation devices. So
I was sitting next to a gal from Saudi Arabia to London, and this woman was like, "Oh, you're into health and wellness. Da, da, da. People need to know more about menopause and the issues with postmenopause." And I had no idea it was that big of an issue until she told me about it, and how there's not many resources out there. And my cleaning lady is suffering from menopause right now, and I didn't know she was suffering for the last 5 years she's been with me. And she has hot flashes. She's hot all the time, and she has brain fog. So what can you recommend to people to help with that? And
this has become probably the hottest topic out there right now in the longevity space and the research space and the investor space, is women. I mean, they just pledged billions of dollars into women's research because of this, and some of the studies that have just come out. So we know now, just in general, we now know that women, once they start entering that perimenopausal area where they are having irregular cycles or starting having brain fog or hot flashes, they should consider going on bioidentical hormones or hormone replacement. I'll say bioidentical specifically, hormone replacement. That could be estrogen, that can be progesterone, that can be testosterone, that could be all of the above, depending on what medical issues they have and kind of what their openness is to it. So that's the major thing that we're looking at, is that they need to kind of replace those as quickly as possible. We know they have about a 5 to 10 year window before they have potential permanent risk of Alzheimer's, problems building muscle, brain fog, weight gain, all these different things that are going to affect their health in the long term. Other things that patients can do is maximize their sleep, work out more. We're now everything seems to be coming back to rapamycin. Rapamycin is now being studied to help women delay menopause. We're now potentially using NAD for the same thing. And there's some other things that are potentially coming down the pike in the next year or two that the goal is to delay menopause as much as possible at this point because of the side effects. And then what we do is, again, we replace the hormones as best we can, and then we treat the symptoms based on what they have. If they have hot flashes, usually the hot flashes either will help with progesterone, or it could be a cortisol or stress hormone issue, and we help replace that, and that tends to go away. If it's a weight gain issue, there's a lot of different ways we can handle that as well. So now we take the big picture, see where their hormones are, and then we can kind of fine tune and treat the specific issue that they may have. Other things is doing weight bearing exercise either on their own. There's a place called OsteoStrong, which has specific exercise and patented workout routine for women to help maintain their mass and potentially and decrease their menopausal symptoms. It was partly founded by Tony Robbins.
The space in New York?
It's all over. It's franchised all over the country now. It started in LA, Miami, and here, maybe 7 or 8 years ago at this point, and now they're pretty much all over the country.
Do they take insurance?
No, not as far as I know. I think it's all cash pay.
If someone can't afford it, how would they get bioidentical hormones?
As I kind of changed my language, we now know that, again, if it's cost is an issue, you can get progesterone covered through insurance, usually very inexpensive. You can get estrogen either through a patch or a pill through your, or vaginally through your insurance. It may not be as strong as getting it bioidentical, but usually will help relieve symptoms. The type that you get really depends on what your other medical history is. We know that potentially the pill may have more of an issue in terms of clotting and some other things, but that tend to have been disproven at this point. The patch is weaker, and some women don't like wearing a patch all the time because the people ask what it is, and they just cosmetically don't like it, but it's low cost and it gets them some of their symptoms to improve. So there's a lot of prescription ways. Testosterone is not indicated in women no matter what, and that's the only one that they would have to do a bioidentical. Obviously in men it is approved, but everything else they can get through insurance usually.
I take 100 milligrams of pregnenolone a day for brain optimization, memory, sleep. What do you think?
I think it's kind of gotten a little bit of overrated from some supplement companies. I think, again, it's kind of what I said before, is that if you do a lab test and your pregnenolone's low, or your testosterone is low, then it's great. But what happens is that people don't realize, as people take too much testosterone, pregnenolone makes testosterone. Pregnenolone is the head of the kind of the pathway, and then kind of testosterone is kind of at the tail. But if you have too much pregnenolone because you're over supplementing, then you can make too much testosterone, which converts to estrogen, and that's when you get hair loss and gynecomastia, which is man breasts and things like that. So I only use it when the labs show me that I need it, as opposed to people like healthy 25-year-olds. I'm very rarely putting them on pregnenolone unless their levels are low, or they have a traumatic brain injury or something else where I need to do it. It's one of those ones I think has been overblown by a lot of the supplement companies out there. I don't think everybody needs it, and it's got to be it's not harmless because it affects everything else downstream.
How about enclomiphene?
Love it.
You love enclomiphene. I was on it for 3 years.
Enclomiphene is great because it's working on maximizing your natural testosterone production, as opposed to like injections where you are going around it and potentially shutting down your body's ability to make testosterone. Plus it's a pill versus an injection, so that's always a bonus as well. So that tends to be my go-to for most of my male patients initially, just because of all those different factors.
HCG?
I like HCG. It's harder and harder to get for a variety of reasons. It's expensive. It does work. It's great for younger men in terms of boosting testosterone, dealing with some of the side effects that can be done with testosterone replacement, in terms of testicular shrinking and gynecomastia.
Let's tell the audience what HCG is real quick.
Urim chorionic gonadotropin. And it works differently in terms of helping the patients boost testosterone. And it also, again, I'm trying to remember the whole mechanism now.
Where does it come from?
It depends where it's sourced from. If it's a prescription form, it is derived from a lab. Otherwise, it comes from different animals. You get the bioidentical component of it. It depends where you get it from, because a lot of people can't afford the prescription one anymore, because the prescription one could be like $1,000 sometimes. So we use it more for the side effects in younger guys to boost their testosterone levels. I don't use it as much as I used to, but it definitely works for the right patient.
What are some more exciting therapies?
I mean, I think follistatin, which is a myostatin inhibitor, which helps patients with building muscle. Exosomes, stem cells. I think clotho would be the other one. Clotho is derived from your kidneys. It may help in terms of an anti-aging. We know it helps slow down brain aging. There's debate with a lot of these things in terms of what is the best mechanism. I've seen everything from a skin cream to a bodysuit to a gene therapy where you inject yourself once a year, every 6 months. And we're just waiting. I think by this time next year, we have this conversation, there'll probably be 2 or 3 out already. They're coming probably this year. I know the company that does follistatin is one coming down the pike. I know 2 companies out of the country that are going to have one coming out very soon. But I think those are probably the things that we're going to be seeing.
What about an AI service that looks at your comprehensive blood panels from 7 years that you've been doing quarterly for 7 years in a row, and they check your whole genome sequence, and they give you an AI model of what to eat, which compounds to take?
They can go one step. So they're now using that to find supplements or prescription meds that could be used for aging. And that just came out like 2 weeks ago. Things that we never thought could be used for aging that we now may use for aging, anti-aging. But it can't always take that data, plus look at your lab data right now, plus look at just examining you and whatever your lab data is, and combine all that and have the nuance to get you there. There's AI services that will look at your other parts of this, but that takes all those things. Yeah, in a year or 2, that'll probably be out.
Yeah, take your Pronovo, your Clearly Heart Scan, all the tests, the Genova Diagnosis test for your microbiome, allergy tests, and just combine it all and gives you the perfect nutrition and exercise routine.
That person would be a billionaire. I just think at this point, there's a lot of nuance. The way I would treat one person with the same data is not the same way I would treat the other person. So it has to learn that. And that takes a lot of time, a lot of data. So that's the thing with AI. It's not like out of the box, it's ready to go. I mean, all these companies say we need more data, more clients. And then they get to that aha moment, and they're not there yet. I think, again, in a couple of years, that's the end all be all. But I don't think we're there yet.
Okay.
We're not there yet.
Are you well versed with stem cells?
Moderately.
What's the best stem cell? I mean, there's fat adipose, there's your bone marrow, there's umbilical cord and placenta. It's
changed literally every 2 months now at this point. It used to be umbilical cells were the best. Now, talking to different people, it's culture lines. There's something called mu cells, which are quote unquote hardy in the sense that they won't be degraded, and they will deal much better with the body's attack on it because they're not used to it. They may have greater potential. There's only 1 or 2 companies in the world that are using them now. But the main thing, it switched from young baby umbilical to probably more lab generated germline stem cells. That may change in 3 months. I think it will. But I think that's where things are going at this point. More and more genetically engineered, not engineered, but very controlled production of stem cells, probably out of the country. And I think most people who are going to want to do those procedures are going to probably have to go out of the country at this point. Mm-hmm. But they have just huge benefits from everything from Alzheimer's to joint pain. So I think it's the future. It's just, I think it really need to fine tune some stuff with it. Okay,
great. Well, thank you. Where can the audience find you? What's your Instagram handle?
The Instagram handle is Dr. Paulvin, Paulvin, and my website, which is doctorpaulvin.com, one or the other.
Okay, perfect. All right. Thank you.